Welcome back to Central Valley Talk. I'm Mike Briggs, and we've been coming to you every day since 2008, telling you celebrating what's good about Fresno. Not just Fresno, but the whole valley, the whole state, the whole nation. There's so many cool and important things going on, and we want you to know about them. Right now, there's a study going on about prenatal care, and it's being put on by Embrace. We're going to find out about them and how maybe you, as a person who's having a baby or as a provider of prenatal care, how maybe you could get involved. Our guests are Kristen Caraway and Erica Martinez. Welcome.
Thank you for having us.
Do I have the name right? Embrace?
Yes, Embrace Prenatal Care.
Okay.
Yes.
And you're doing a study of what?
Yeah, we're doing a study to compare two different kinds of prenatal care that's available to women here in the Central Valley.
Are there just two kinds?
Two kinds right now.
Okay.
We're looking at individual care that's offered with CPSP, Comprehensive Perinatal Services, normal way of getting care. And then we're looking at GLOW Group Prenatal Care, which was developed with First 5 Fresno County. And we're just trying to see how does that impact maternal mental health, looking at depression, anxiety, and then how does that impact preterm birth,
Okay.
babies being born early, and then how does it affect the perception of care, the quality of care that women perceive they're getting.
Now, so it's all prenatal, nothing after the baby's born?
Right. So we are focused on the prenatal aspect, although GLOW and individual care does have like a postpartum session, but it is prenatal care.
So GLOW would be, or individual. It's GLOW or individual right now?
That's correct.
So individual, each doctor, and there's hundreds or thousands of them, I would imagine, prenatal doctors, and they just do their own individual program.
Right. So the way the study works is that we're partnering with different clinics here in Fresno County, Merced County, and Kern County, and they have to be willing to offer both individual care, which they already do, and GLOW. And we're recruiting from their patients.
So who do you want to call you? The doctors, the patients, both?
Both, actually. We're still recruiting for providers to join the study, and we're recruiting participants. So if you are someone who's pregnant and you are currently with one of our providers that we're working with, we'd love to get you enrolled if you meet the criteria. And if you're a provider who's interested, we'd love to talk to you and see what we can do.
Okay, so, and this is intended to improve the prenatal care?
Exactly. We're wanting to, the whole study came about because we noticed a few years back there was high infant mortality in the African American community, and one of the leading causes was preterm birth. So GLOW came out of, was a recommendation out of a needs assessment. And so they did an initial, just to find out feasibility of GLOW, and now we're trying to see, does it have an impact?
Okay. Now, is this just Fresno County, the whole state?
Right now we're working in 3 counties.
Okay.
We're looking at the Central Valley, so Merced, we're working with the provider there, and then also in Kern. But we're open. We've been in discussions with different counties as well, so we're open to anyone in the valley.
So if somebody's an expectant mother and they say, well, I guess, what would it involve for them? Would they have to like go on the computer and fill out forms or keep a regular log or something?
Well, it's pretty simple, actually. We have our wonderful recruitment team. Erica oversees that, and they talk to the participants and kind of go through the whole consent process with them. And then they work with either just going to their regular prenatal care appointment, or they work with the GLOW team. And again, the team there handles all of that. So it's not a lot on the patient.
But maybe they might have a little financial incentive to get involved?
There is.
Because I'm just thinking, here's a young mother and she's overwhelmed and she's got all these things to do, and somebody says, hey, we want you to come and help us. So
absolutely. We understand that, and we really value their time and their input. So participants are able to earn up to $130 by completing 3 different surveys. And that doesn't matter if they're in group or individual care.
Okay, so
Yeah.
$130. That's a lot of money. That could help. What's the criteria for a patient to be in?
Okay.
Is it African American patients or anybody having a baby?
Anybody. We'd have some pretty simple criteria. One, that they are under 24 weeks gestation. And then they are Medi-Cal eligible. They don't have to be on Medi-Cal, but if they meet the criteria, they're able to be part of it. Also, they have to be willing to be part of individual and group care because it's randomized. They don't get to choose.
They don't pick.
Right. And then be part of a clinic or, part of a practice that we're working with.
Okay. And doctors, or what do you call providers, we
Yes.
should say,
Yes.
what's their criteria?
They just have to be willing to, they have to provide prenatal care and then be willing to offer Glow Group
Well,
prenatal care.
maybe they don't now.
They may not now, but we do offer, we partner with First Five that can coordinate all of the training that they need. And they also get an incentive as well. We do offer up to $500 per participant that enrolls in individual or group prenatal care. And then they can also work with First Five to help with supplementing some of the costs there.
Very good. And why is this study important?
The study's important. It's a national study, and it's because, we're seeing that women and children are being impacted, and we want to do something to address that. If we have such high infant mortality and preterm birth, especially in, our most desperate populations, we're hoping that this can inform policymakers on things, on ways that they might be able to shift the way care is provided.
I was, as a former policymaker, we love information, not just
Absolutely.
political, being pulled this or that, but real factual information from studies to help make decisions. Probably mostly this will be state, but it's a national effort too.
Right. I mean, we're working with our funders, which is PCORI, it's Patient Centers Outcome Research Institute, along with UCSF and First Five. So, it's a lot of different levels that are involved.
Very good. Now, if somebody says, well, sounds interesting, I'll look into it. Where should they start?
Yeah, absolutely. Feel free to reach out to us. You can reach us at 559-549-4977 or go to our website, embraceprenatalcarestudy.org. Or you can email us at embrace at mail.fresnostate.edu.
Yeah. Now, some people aren't into the websites and phones. They just like to go on social media.
Absolutely. You can reach us. We're on Facebook and we're on Instagram.
Okay.
And it's just Embrace Prenatal Care Study.
Embrace. Let's see, Erica, anything we're missing?
Yeah, so if you see us at your next appointment, we are usually in the waiting room area. You will see our Fresno State badges. Come ask us if you have any questions. If you want to join, feel free to come up to us and ask us any questions.
So you actually go to providers and sit in their waiting room waiting for somebody to come in.
Yes, we do.
And,
And we partner and we work very closely with the clinic staff to make sure that we do approach all of those patients that are pregnant.
And they're for it. I mean, it's all,
Yeah.
everybody's cooperating, trying to get a better outcome for,
Yes.
for prenatal care here in Fresno. What counties?
Fresno, Merced, and Kern.
Fresno, Merced, Kern counties. If you're in one of those counties, it's free to call, right?
Absolutely.
Just call and find out, see if you'd be a fit, see if you could participate, see if maybe you can, have a little income from it, a little
Yeah.
stipend just to help you through the expenses of doing that. Huh?
Exactly.
Anything else you want to add?
No, it's just we're recruiting through the end of January. So we are, in the home stretch of our study, but we're still welcoming on new providers and new participants. So please reach out. We look forward to working with you.
There's this beautiful poster. We're going to leave it up for a few minutes after we go off. Anything we need to know about, or you want to tell us about it?
This is just one of the posters you might see in one of our doctor's offices, and it just gives you the general information and the criteria to be able to join.
Okay, very good. And we appreciate your time. This is important, and the group is called Embrace
Prenatal Care Study.
Prenatal Care Study, and just go to embraceprenatalcarestudy.org. If you didn't get the information, you want more, call us here at Central Valley Talk, and I'll give you the info. And we will be back with more Central Valley Talk and good things going on in our community right after this.